October is Autism Awareness Month, and the Government of Canada has launched a new framework for autism in Canada and a new Canadian autism strategy. They're also recruiting people with lived and living experience and experts to inform a new national autism network. We're going to talk a little bit about that today, but first we're going to learn a lot more about autism. My name is Eric Bowman. I'm the communications person at the Canadian Psychological Association, and this is Mindful. Many of us have some sense of what autism is. And we know there's a spectrum, and we almost certainly know someone who's been diagnosed. But a lot of the details remain a little murky. I wanted to get some clarity, and I was lucky enough to be in Halifax earlier this month to be able to speak with an expert in person.
My name is Isabel Smith. I am a clinical and developmental psychologist. I'm a professor in the Department of Pediatrics at Dalhousie University. I have just retired as the Joan and Jack Craig Chair in Autism Research, which is an endowed chair position that I had the privilege of holding for 10 years. But I work at the Autism Research Center at IWK Health and Dalhousie University in Halifax.
Excellent. And so we want to talk about autism today. And I feel like a lot of us don't have a proper definition of what autism is or a proper grasp on what exactly it is. Is there a definition for autism?
There's absolutely a definition, but it's been a bit of a moving target because in the 40 years I've been involved in autism research, the definition of autism as a condition has shifted quite dramatically. We think of it as a neurodevelopmental condition, which means that it arises from differences in brain development. So those are evident early in life, although in some individuals, the differences may not really become very apparent until later. The differences are evident in the development of communication, so the ability to relate, convey ideas, have conversations with other people. In social development, so the ease with which you can relate to other people, and in behavior with respect to things like flexibility, intensity of interest in particular topics, sensory differences, so reactions to things in the environment like light and sound. And there's this constellation or pattern of differences that we see as part of what we call an autism spectrum condition. And we refer to it as a spectrum because the impact of those differences on the person's life can vary tremendously from relatively mild to quite severe. The other thing that makes it really complex to try and define autism is that it frequently co-occurs with other neurodevelopmental conditions, such as attention deficit hyperactivity disorder, and with differences like intellectual disability and or learning disorders or more specific learning difficulties. In addition, people with autism spectrum conditions are more vulnerable for some mental health conditions like anxiety disorders. So what you end up with is the spectrum of autism traits that vary, overlaid with other conditions that interact with autism. So that's why I think a lot of people have difficulty spotting autism in a given individual because it can look so different, even though the underlying pattern of those core differences in communication, socialization, and behavior can be defined from a clinical's perspective.
That was something that I wanted to touch on is this idea of a spectrum. And because you say that so many co-occurring disorders can happen, it's tough to pin down because I wasn't clear on whether autism itself was the cause of all of the things along the spectrum and whether it was varying degrees of severity of autism or whether that was all different types of things that we all call autism that,
And I mean, that's like the $64,000 question, to use a very, very dated reference. But I mean, we don't really know, right? Because we don't really know what causes autism. We don't have a biological or a genetic definition, of autism. What we have is behavior that we see, and as clinicians, we define basically based on this pattern. And it's hard to know to what extent the other sort of what we see as co-occurring conditions arise from the same roots as the autism
Right.
traits, whether the autism traits convey, more vulnerability to the other conditions, like how those things are related exactly is really quite challenging to tease apart, which is part of why so many different disciplines are involved in autism care and why autism research is so multidisciplinary, everything from genetics and biochemistry to sociology and,
Right.
So because part of what we also are seeing in autism is interactional, because autism affects how someone perceives the world and the ease with which they interact with others. How we respond to autistic people affects their behavior as well. So
Right.
part of what we see as an autism spectrum condition is a result of differences in how the rest of us and the world
Right.
respond to them. So it is complex. However, when I say it's complex, I don't want to convey that, we're unable to diagnose it when we see it. Mm-hmm. Because, again, to someone with experience and the right training, the underlying pattern of differences in autism is usually quite clear. It's,
Right.
the ability to diagnose it is clouded by the need to tease apart all these other factors, environmental factors, social factors, other co-occurring conditions. But autism diagnosis is actually, a pretty reliable, among the mental health conditions and
Right.
neurological conditions, a pretty reliable pattern to spot, again, for an experienced clinician.
And over the years, you
Yeah.
say that the definition has changed a
Yeah.
little bit, and
Yeah.
presumably the
Or quite
ways
a
of
lot.
spotting. Right.
Yeah.
And
Yes.
From what I
Yeah.
understand, being able to treat it has
Yeah.
changed a lot too, and
Absolutely.
there's been a lot
Yeah.
of progress made. Where,
Yes.
of course, when it
Yeah.
people first started paying attention to it, no one would have any idea how to treat this.
And
now,
it was when it was first identified, it was regarded as, basically the fault of the mother. I mean, it was one of the
Right.
many conditions that, because it appeared in infancy, it must have been bad mothering. In addition to the definition changing, and as part, I guess, of the definition changing, we've also become better at spotting autism in very young children, among people with other conditions, among women and girls in particular, because autism is much more prevalent in males. But part of what seems to be emerging now is the idea that maybe it manifests a little differently in girls and women, and we've been underreporting it
Right.
in girls and women. And certainly among adults with more typical language and cognitive development, there's been underdiagnosis as well. So what we're facing now is a need to sort of catch up and identify autism better among older individuals, as well as, the trend to and the need to identify it early.
Right.
When we identify it very early, often what we're picking up are sort of emerging signs. And so that's been a major area of research, and one that I've been very fortunate to be involved in is identifying early signs of autism in infants and toddlers, so that when we do intervene, part of what we're trying to do is shift those children toward a more adaptive trajectory.
Right.
So, children who are having difficulties in social and communication skills and their behavior very early on, where we can intervene in ways that sort of give them the opportunity to interact more typically with the world and their families and other kids.
Right. And
So
I imagine
yeah.
starting extremely early makes that a much easier process.
Exactly. The earlier you intervene, sort of the less divergent the
Right.
trajectory is from the typical.
And when you say you're looking for signs,
Yeah.
different communication abilities,
Yeah.
that sort of thing,
Yeah.
at a very early age, I
Yeah.
presume you're not looking for those things, right? Someone else has to spot them first and then come and see you.
Right, but again, as a researcher, we look for them, for example, in studies of children who are born in families who already have a child with autism.
Okay.
Because there is an increased likelihood of autism reoccurring in a family if they have a family history of autism. So one of the research studies that I've been involved in that's been led by colleagues here initially by Dr. Susan Bryson, who was my predecessor in the Craig Chair here, by Dr. Lonnie Zweigenbaum at the University of Alberta, and Dr. Jessica Bryan at the University of Toronto. We've done a longitudinal study in which we recruited families who had a child with autism, and then we basically monitored their babies from before there were any signs, looking for the higher probability of signs of autism. Mm-hmm. So that research, which has been done by many other groups at similar research design, has taught us a great deal about what autism can look like very early on, and has given us the opportunity to look at ways of intervening and sort of helping helping families in particular interact with the children in a way that shifts their skills toward the more adaptive.
Right. And what does that look like? Somebody who's more adaptive because there's been a very early intervention versus someone who maybe wasn't diagnosed until they were 5 or 6 years old.
Right. One of the biggest differences, I think, is in the development of communication skills. So the children who tend to be identified very early often are very delayed in using both verbal language and the ability to communicate using gestures. I mean, as we're recording this, I'm waving my hands around, which may or may not be communicating much, but young children use gestures, they imitate other people, and all of that is part of communication. When those skills are delayed or present in sort of lower frequency, it's very hard to help the child learn to play, to interact with other kids, to learn sort of daily living skills, because that avenue for passing information along is impaired. Mm-hmm. So working on communication skills, helping parents learn to read the child's signals, helping the child learn to sort of regulate their own behavior and to direct their attempts to communicate to a person.
Right.
Working on those skills very early, again, it sort of bootstraps everything in the child's development. Mm-hmm. It's the difficulty with communicating, with relating to other people, finding joy in playing with other people that can cause other skills to fall behind. Because those are the tools little kids use to learn. Playing and interacting with other people.
Yeah, of course. And I'm wondering, too, as we hear a lot of terminology, and I'm not sure what terminology is
and that
accurate.
Also is shifting.
Right, and it changes, right?
Yeah.
I think at some point we were being advised to say people who have autism rather than people who are autistic, because it shifts the focus.
Yeah.
Is something like autism spectrum disorder, is that a catch-all term that encompasses everything, or are we moving away from that too?
That's a very important point, because that is one of the things that's changing, and it's changing as a result of greater engagement with autistic people. Right. So, now that there are many people who have received a diagnosis, and I'm using air quotes there, of autism spectrum disorder, earlier in life, and who see autism as part of their identity, many of those adults identify autism as an identity and therefore would reject the notion that, they are a person with autism, that they are autistic, and that's who they are. It's a somewhat contentious area in that most of the advocates in the autism community, the autistic advocates, are people who have relatively strong communication skills, obviously, because they're out there advocating. And there is sort of a parallel group of, family members, caregivers, parents of more severely affected autistic people who may lack the ability to express their own views, and whose caregivers still prefer language around autism spectrum disorder or person with autism. So there's a shift, but also a little bit of a split in the community around the use of that terminology. Okay. And so the general guidance now is to ask a person or a family what terminology they prefer. Because, although it's perfectly valid to think of autism as an identity and to think of the traits associated with autism as being, variations on the human condition, and that's the view we now refer to as sort of neurodiversity, it's also a reality that there are many people whose ability to function in the world is so affected by their autism that, to use terms like disorder or impairment seems justified, because these can be people who need a great deal of support to function. And so their advocates don't want us to lose sight of the fact that those people are in need of a great deal of support by referring to their autism as just part of their identity, because they, for those people, their advocates see it as a disability.
Yeah.
So it's a sort of fraught area currently, quite frankly, for families, for professionals. And I think just that the solution is just to be respectful of people's wishes and to make clear your own stance. And as a clinician, one's job is to help people adapt in ways that increase their well-being.
Right. Yeah.
So, that will look different depending on what the person's, strengths and challenges are.
Mm-hmm. And I wonder, too, about terms like high functioning and low functioning.
Yeah, and those I think have pretty much gone out the window, as they should have. They were never defined in any way that I found useful.
Right.
I mean, as a clinician, if somebody, for one thing, it often was presented almost as a sort of badge of honor, like, my child is high functioning.
Right, yeah.
And then the next parent comes along, well, sorry, mine isn't.
Mm-hmm.
It's that seemed divisive to me, but also functioning in what regard? So,
right.
As I've said, a person with autism spectrum disorder might have relatively severe autism symptoms, yet have good cognitive abilities, language abilities.
Mm-hmm.
Are they high functioning because of that? Well, maybe not. Whereas someone who may have some cognitive differences that affect their ability to function, yet their autism symptoms are not as severe.
Right.
How do you place those things on one continuum? You can't.
Mm-hmm.
So the high functioning, low functioning sort of that distinction made the error of assuming that it was one continuum.
Right.
When in fact we're talking about overlaying multiple continua: the autism symptoms, the intellectual ability, the language ability, the everyday living abilities.
Yeah.
So, it's a multi-dimensional spectrum, which, challenges us all to use our spatial skills in ways that some of us struggle with.
You said that we don't know what causes autism, and you also said that families who have one child who...
So, there absolutely are heritable forms of autism. Again, not at all straightforward. Hundreds of genes involved.
Right.
And again, I'm a psychologist, not a physician or a geneticist for sure. So my understanding of the genetics of this is at the layperson level. But it is genetic to the extent that there are genetic differences that predispose people to develop the pattern of behavior that we call autism.
Mm-hmm.
The challenge is to figure out which of those genetic differences are heritable, because not all genes are passed on, right? And whether or not there's a correspondence between what the genetic difference is and what the behavior looks like.
Yeah.
And that's the piece that still remains, I think, very challenging. There's a huge amount of research in that area, and there has been for years, and there's, we don't have a solution yet.
Yeah.
So nothing about this is simple, and we're still, I think, some way from those differences translating into differences in treatment or interventions.
Yes. Right.
And again, terms like treatment and intervention are also anathema to some autistic people who don't see their autism as something to be treated or cured. So that language too is challenging, because we don't treat people's identities. But again, as a psychologist, as a clinician, what I think we support or treat or intervene with is differences that affect somebody's well-being.
Yes.
So if somebody is struggling because they have a severe anxiety disorder, you intervene whether they're autistic or not.
Right, of course, yeah.
And, similarly, children whose autism is associated with behavioral difficulties, like, disruptive behavior, like struggling, in crowded situations and lashing out, that sort of more difficult behavior, you intervene to help because those are expressions of distress.
Yes.
And they may be rooted in difficulty communicating or difficulty getting along with people or reactions to, the environment they're in. If it's a crowded, noisy school, you intervene by understanding what's in that individual, what's triggering that behavior, and figuring out ways to help it adjust circumstances and teach the person skills to cope. So to me, that kind of intervention is appropriate because it's removing barriers to participation in the social world, in the child's school environment. So, I'm not averse to thinking we need to intervene when somebody's struggling.
For sure.
And that's not about changing who they are any more than psychological interventions for the rest of us are trying to change who we are. They're trying to remove, again, barriers to participation or things that interfere with our well-being.
Yeah. And one thing I think that we know doesn't cause autism is vaccines. I'm wondering...
We absolutely know that, yes.
We know that, so I don't want to spend too long on that, but I'm just wondering if the uptick in, over the course of COVID, where all of a sudden there's a lot of questioning of medical knowledge and practice and all this, and that there seems to be more vocal opposition to the things that we know work.
Yeah.
Has that made your job more difficult?
I think that's made the job of all healthcare providers more difficult. Because it's not just about vaccines, it's about a distrust of healthcare professions in general. The notion, I think it's also related to things like, the rise of the internet as a source of information and social media as a source of information. The notion that, everybody can do their own research. When research means, reading whatever the social media algorithm is pushing at them. As opposed to our understanding of research as psychologists or as, other, healthcare providers, that, you actually look at empirical studies and decide, what is fact based on the best available information and act based on that. I do think one of the other things that happened during COVID, and I've certainly seen people writing about this, and I wish I could credit specific sources, but I can't, is the idea that because evidence changes, because that's the process of science, people distrusted information they were getting because it would change. So we knew nothing about COVID because it was a new disease.
Brand new,
Yeah. So the initial advice wasn't exactly the same as later advice. And so people, I think, who are less aware of how science works would see that as a reason to distrust the professionals who had, changed the story.
Right.
But what they're doing is acting on new information, new evidence. And so I think that's a phenomenon that we all need to be aware of as well. And what that says to me is we need better science education and better science communication education, for all citizens, but obviously starting with kids, so that people understand that knowledge isn't a fixed set of stuff. We learn things. And again, our understanding of autism has changed dramatically. Again, I've been in autism research for 40 years. Things that I would have said 40 years ago are absolutely wrong now.
Right.
And it's because we have more evidence and a different conceptualization, a new understanding of neurodiversity and of neurodevelopmental conditions. It doesn't mean that, I hope it doesn't mean I was an idiot or untrustworthy back then, but it means that my understanding has changed because I've been reading the evidence.
Yes. Yeah.
And contributing to the evidence.
Well, and I want to talk about some of your contributions to that evidence. We have new federal guidelines. We have a new sort of framework federally for looking at autism. Yeah. And I know you contributed something to that. Can you tell me about the part you played in it?
Well, a very small part. So one of the initial steps in this new initiative was that the Canadian Academy of Health Sciences convened a group to do an assessment of sort of the state of autism in Canada. So reviewing the research literature sort of broadly, not just Canadian, and, engaging both experts from the sort of research and clinical fields and experts from, the lived experience field,
right.
Autistic individuals and their caregivers, family members, policy people, a large group of experts who were organized into a number of working groups around specific topic areas. And we came together in groups to draft a report on sort of the state of autism.
Yeah.
That was published in 2022, I believe. Dr. Lonnie Zwagenbaum, who I mentioned previously, from the University of Alberta, co-chaired that whole process. I was involved in the working group that was looking at diagnosis and services, early identification, diagnosis, and services. So I was there, in my capacity as a clinical researcher who's done a lot of work on early diagnosis. I'm formally trained as a trainer on some of the common diagnostic instruments. I've done research following the development of children with autism for many years, and I've done a lot of research on early interventions for autism. So, my contributions were as part of a large group of people contributing their ideas to that piece of that report and drafting that report. So it was a very collaborative process, and I think a very thorough process. And I think we can all be quite proud of that report. I think it's a nice model for other countries actually to follow.
And so when we're talking about early childhood detection and intervention, I worked for some time in the field of dementia. And one of the issues that we had as the Dementia Society was that family doctors, for example, didn't know where to refer somebody if they suspected that there were signs. They also didn't really know what signs to look for, right? And there was that was the major gap. Is that one of the gaps that there is when it comes to autism in very young children?
Yes, less of a gap than it used to be, because I think we've become increasingly aware, over the last decade anyway, of the need to look earlier and to look at those sort of more subtle signs of emerging autism, to sort of, catch it before, there's this cascade of difficulties, some of which are secondary to the actual autism, as we've said. So I think there's been quite a lot of work in most provinces around, earlier detection and early intervention. Certainly Nova Scotia had a really innovative early intervention program that was unlike that in other provinces starting in 2005. Big part of my research career has been sort of documenting, the effectiveness of that program. I think, though, one of the things that the autism assessment by the Canadian Academy highlighted, and one of the reasons why the subsequent work on the autism framework and strategy that you referred to has been necessary, is that the variability across Canada is enormous in terms of how effectively kids are identified and adults are identified, and what sorts of interventions and supports are available to them. So, that was a really striking finding, is that depending on what province or territory you live in, what you can expect to happen if your child appears to be on a path toward autism is very, very different. And I don't think any of us thinks that's appropriate.
Right. No. And does this framework seek to address that and have some sort of national standard?
Exactly. So the framework is sort of setting the stage around the sort of areas of focus that the Canadian Academy report identified, as well as a lot of stakeholder engagement, sort of both within and separately from that report. There's been tremendous engagement of autistic people, their caregivers. Indigenous communities were very well represented in that process and continue to be. And so the framework sort of identifies the priority areas, which are everything from early identification, interventions to vocational opportunities, housing options. It's really a lifespan approach. And then there's an accompanying autism strategy, a 5-year strategy that's more about sort of what are the actions that the federal government can support through both in itself and through the provinces by increasing collaboration among the provinces around these priority areas. So, things like national standards could emerge from that, and I would hope there should be some national expectations as to, things like diagnostic assessment, because, best practices are pretty well understood and pretty well articulated in the literature, but access to those best practice assessments is quite limited across the country. Similarly, supports around, employment and vocational opportunities and so on could be made more available, and that can happen through, the sorts of incentives that the federal government can encourage the provinces to offer, right?
Right, so, social enterprise and that sort of thing.
Exactly. So there are lots of things that will happen, at local or provincial levels, but the federal government is in a position, I think, to provide incentives and to bring the provinces together, because I think that's the piece that's been missing. Autism services have arisen independently in each province with somewhat different interpretations of what the evidence suggests and different ways of implementing the evidence in the context of whatever that province's resources are and their demographics, which obviously make a difference as well. So again, it's just a very uneven landscape. I mean, even within the Maritimes, Atlantic provinces where I live, things are really different. Nova Scotia, New Brunswick, Prince Edward Island, and then again in Newfoundland, even though we're so close together and so demographically similar. One of the studies I did was comparing early intervention programs in Nova Scotia and New Brunswick, which it's the only comparative study we have in Canada. And again, we're side by side, very similar provinces and completely different systems, from everything from what government department oversees those services to how the services unfold for families, what families' experience is, what methods are used. Couldn't be more different, really.
Right.
In some ways, which is startling when you think about it. So if you live on the border between New Brunswick and Nova Scotia, those few miles.
Where do I go? If I live on the border, which province should I choose?
Well,
if I'm in
I don't know that you get to
Campbellton
choose, right? Because the funding comes through your province. So.
Right.
So it's, it's just those sorts of discrepancies mean that we could do a much better job of sharing information, because obviously there are strengths in every system because they've developed around the needs of their own provinces. But there are also a lot of common denominators that we could be addressing in more similar ways and sharing more information.
Yeah, when you say that a lack of access to best practices is one of the things that needs to be addressed here, is how much of that is because of this difference in systems where we're doing it differently from province to province, and how much of it is a lack of resources or a lack of trained professionals that can provide those best practices?
Well, I think you've identified all the things that are all part of it. And one of the things identified in the report and identified as a priority in the new strategy is training for professionals. So, depending on whether you happen to be trained in a program that had people with autism expertise or not, again, speaking as a psychologist, if you had the opportunity to go to a graduate program where people had autism expertise, you get that expertise. If you didn't, you're not going to get it.
Right.
Or, if your internship was in a place that had a lot of autism services, you would get that or not. So that's true across the board for health professions. It's true for teacher training, for, all kinds of other areas. First responders. That's, there are all sorts of areas in which lack of awareness of how autism presents and how best to support a person with autism or an autistic person, depending on which terminology we're using, can have a profound impact. I have personal experience of some horror stories of, police, arriving in a situation where an autistic person is experiencing difficulty and not knowing that or not believing it, even when the family said, this person has autism, respond in a way that just escalates.
Right. Yes.
That's the problem, right? So, if that awareness and acceptance of the differences associated with autism were broader, it would be easier for autistic people to live in the world. Mm-hmm. And so that another piece of the strategy is an awareness and acceptance campaign to sort of increase the general public's understanding of the spectrum of autism and associated difficulties.
It strikes me, an awareness campaign, people are more familiar with it, people are more accepting of it, and understanding of it. Yeah. And it reminds me of the, acceptance campaigns that we have for LGBTQ people, for transgender people, that sort of thing. But it also makes me think about the way that, some of the pushback against those things which is we see way more LGBTQ people now than we did when I was a kid. We see more autistic people now than we did when I was a kid. Yeah. And I'm wondering, with LGBTQ, the obvious answer is, well, no, they existed then too. They just were quiet about it because it was a more dangerous time. Okay. Whereas, years ago, right, you didn't have the same diagnostic tools. You said women and girls are underdiagnosed, older people are underdiagnosed. Yeah. And are there more people with autism now than there used to be, or are we just better at finding it?
We're certainly much better at identifying it. And again, as I said, the definition shifted to be broader, to recognize the spectrum. So more people fall under the definition that we use now than the definition certainly we had 40 years ago. Right. But actually my entry into the world of autism research was in a prevalence study, an epidemiological study that was run in Nova Scotia in the 80s. And at that time, the definition had started to shift. There had been a major shift in sort of the definition of autism. And so in that study, we identified 3 times as many autistic children as would have been done under the previous definition. And that was in the 80s. That number is so far below what we now would identify because the definition has continued to shift. Right. But again, that doesn't mean those people weren't there. We just used different terms to describe the challenges they were experiencing. Right. So when I think back to where we drew the line 40 years ago, there are lots and lots of kids I can picture in my head who were outside the boundaries then, who absolutely, if I were to see those kids now, I'd say, it wasn't as pronounced. We were more likely to say if there was a severe intellectual disability, that was the diagnosis, not autism, or if there was another mental health condition like severe anxiety, that was the problem, not autism. So the autism was being overshadowed by other things in the children we saw 40 years ago, and decided, no, that's, we had this sort of purer, what we thought of as at the time, purer group with just autism. But that's not the reality. Right. I mean, what we accept now and seems very obvious to us now is that these things overlap. Right. But again, that doesn't mean we were wrong then. We had a different view, a different definition, a different understanding of how these things interact. And now we see it differently.
Yeah. So in terms of awareness and, acceptance and understanding of autism in the public in general. Yeah. And going forward, we have this new national framework. We have some obvious goals that we've set that we want to meet. What do you hope happens, and what do you hope people learn and understand about autism if they're, new to learning about this now?
Well, I hope they understand that, autistic people are part of our community and always have been, that their differences are, again, part of who they are, but also affected by the world we create for them and the way we interact with them. So I think us understanding the impact of our behavior on other people, whether they have autism or not, is important. If you bully somebody because of their differences, that's not good. And youth with autism are bullied at rates that are far beyond
Right.
Well, any bullying obviously is far beyond what we would hope to see. But so what I would hope with a campaign toward more understanding and acceptance is that we recognize that, everything is everything is a spectrum of differences,
Right.
that, we are all human beings. There are differences between us, but there are more commonalities among us than there are differences. And that treating people the way you want to be treated is the right answer, whether or not that person presents differently from you or not. We need to ensure that services are there to support people's well-being, again, whether they're autistic or not, and that, our services shouldn't be exclusionary.
Right.
That we need to train professionals to work with neurodiverse people.
Yeah.
That, access to services for your mental health condition shouldn't be different when you have a diagnosis of autism or a diagnosis of ADHD or a diagnosis of whatever than if you don't.
Right.
That we need to level the playing field for people across the range of neurodiversity and across the country. So we need to train professionals, make services accessible, come up with guidelines and standards that sort of allow people to get the services that they need to make their lives better, regardless of autism or not. Supporting families, I think, is a big part of that from the start, because
yes,
everyone develops in the context of their family first.
Mm-hmm.
And a lot of what happens to families of children with autism is a result of lack of support early on.
Right.
And again, the earlier we can make things better for people, again, the less ground you have to make up
Right.
down the line. So, we need to attend to the needs of, the older children and youth and adults who are already here, but we really, really need to set strong foundations early on for people in development in the context of their families and early services.
Well, that's great. That's all I've got, I think. Is there anything you wanted to talk about that we haven't touched on?
I don't think so. That was pretty comprehensive. I thought, there's always more to say.
There always is, yes.
But again, I guess one of the other things that I do want to just put a short pitch in for is another aspect of the strategy is support for research.
Yes.
And again, I've been very fortunate to be, supported in my research by the Canadian Institutes of Health Research and other organizations for years. But, often there were not funds directed toward research around neurodevelopmental conditions. And I think one of the results of this strategy is that there will be more targeted research funding that will allow that research area to grow. And, I think there are excellent autism research in Canada has been a strength. And I think that it can continue to be, both to contribute to the Canadian scene, but also to the international research effort. Because I think that's important. It's something that we can contribute, and it'll make life better in Canada and contribute to knowledge of autism.
Wonderful. All right. Well, thank you so much. This was great.
Okay, well, thank you for the opportunity.
And thanks to you at home for listening, streaming, rating, and downloading today's episode. For more on Autism Awareness Month, the federal framework and strategy, and for a chance to participate in Canada's National Autism Network, check today's show notes for more details. Mindful is written, hosted, and published by me, Eric Bowman. Our producer and editor is Jamie Montgomery, and our theme music is Avenues by David Taylor.